Schwartz method. The goal of the Schwartz exercise is to de-rotate, elongate, and stabilize the spine in a three-dimensional plane. This is achieved through physical therapy that focuses on restoring muscular symmetry and alignment of posture, breathing into the concave side of the body, teaching patients to be aware of their posture. Katharina Schwartz, born in February 22 in 1994 in Germany. She suffered from moderate scoliosis and underwent treatment with a steel brace at the age of 16. Katharina developed her own breathing techniques and exercise to manage her scoliosis. She and her daughter opened a clinic where they treat more than 150 patients at a time. This method was further popularized by her daughter Krista. She also tried to mirror the deformity by overcorrecting with the help of certain pattern-specific corrective movements. She recognized that postural control can only be achieved by changing postural perception. From 1921, a new form of treatment with a specific postural correction, correction of breathing patterns, and correction of postural perception was performed, with rehabilitation times of 3 months in her own little institute in Mason. And in the late 30s and early 40s, she was supported by her daughter Krista Schwartz. The same program was also performed at that time in Barcelona under the supervision of Dr. Manuel Rigo. They improved many parts of the original program according to the latest knowledge throughout the 90s. At the end of the 80s, they began a training program for professionals, and soon Dr. Rigo was one of the most important international instructors. He brought the original program to the US and the UK, thus contributing the knowledge worldwide together with the author, investigating the outcome of such a treatment. Consequently, the Schwartz method is now known and recognized all over the world. The Schwartz method is a highly personalized therapy. Therapists work intensely one-on-one, coaching and training with mirrors to help patients visualize their corrections so they can make changes and continue practicing at home. Schwartz exercise vary based on age, medical history, and severity of the scoliosis, but a typical exercise generally follows two phases. The first phase focuses on positioning the body. A therapist shows you how to align your posture from the bottom up. Start with your feet. Your therapist will teach you proper foot placement. Then move into your pelvis. He or she will show you how to set your pelvis and adjust weight bearing and angles. Moving up to kinetic chain, the focus is on aligning your rib cage over your pelvis. Finally, the focus is on positioning your head over your ribs. The method also uses equipment like a leather wall for lengthening the spine, and the straps and props like rice bags to assist in positioning the torso. The second phase focuses on activation of the correlation just acquired. This is the muscle endurance training. A therapist will encourage active elongation and expansion of your body using concepts of traction to stretch the body upwards, lengthening the areas that need to be taller and less compressed. Concept of expansion, widening those areas that need to be fuller and broad to draw the scoliotic curve closer to midline. After active elongation and expansion, you may work on addressing the rotation, which shapes the ribs in a way that leaves some areas of the front and back of the rib cage relatively flat. In this phase, active diaphragmatic breathing techniques are important. The Schwartz method emphasizes breathing into the areas that are more concave to help them expand and help derotate the spine. When you exhale, activation of the abdominal and trunk muscles will help stabilize the spine and train the muscles that help control the areas that are curving outwards. Everyone's spinal curve is different. In SWORD therapy, exercises are tailored to patients' unique curve and body. The three-dimensional approach exercises take into account the spiraling effect of scoliosis on the vertebra and muscles. The therapist will use a three-dimensional method to treat the whole spine and the muscles around it. Ages: the SCORE therapy can be used to treat adults, children, starting at 10. In adolescents, it is used alongside the bracing.
The question is asked is the question is asked is START method or intervention useful in an orthopedic setting? And I have proven yes, it is beneficial in an orthopedic setting. There's a study that I came across by Walter J. Nove Psycho in Psycho in 2012 about the STRUT method of treatment for a patient diagnosed with scoliosis. So, patients with scoliosis, they will show many signs and symptoms such as back pain expressed as a muscular soreness, muscular fatigue, or mechanical instability, radicular pain, and claudication symptoms during walking or standing. Additionally, they will experience neurological deficits and curve progression. Therefore, these patients will require some strengthening and stretching exercises, among others, to improve their postural imbalance and to help eliminate their pain. And this can likely be seen in an orthopedic setting. So the research reveals that the physical therapy intervention utilizing the STRUT method approach for treated scoliosis or patient diagnosed with scoliosis is beneficial. One of the main problems that the patient face, as I mentioned before, is postural imbalance, and the postural imbalance then affect their quality of life, limiting them to do the things that they love or do basic daily activity. So in this study, the STRUT exercises were used to correct this postural imbalance, and it proved that it did help to improve the signs and symptoms. The patient in this study, while they visit the therapist will provide maximum feedback correction, and while the patient throughout the episode of care, using the wall bars and the mirrors and resistive tubing, cushions, and exercise balls, chairs, and tables. All of these things were utilized to help this patient, or to challenge this patient in this study, to encourage performance, to encourage her to perform these postural correction in her daily activities. So it was not limited at the therapy session. The therapist would encourage the patient to continue with these postural exercises at home. So in everything that she did at home, she ought to continue with what she was taught at the therapy session at home to help better improve her condition. So after utilizing these postural exercises, the by described by the Strut method, the patient after um, a few weeks stated that her pain was eliminated. The exercises that she did help improve um, or help eliminate the pain. So here we can see that when, especially a person who is diagnosed with scoliosis, that they need to constantly exercise to correct the postural imbalance, because when if it's not corrected, or muscles are not strengthened or stretched, what will happen? It will cause tightness, and and will bring on pain. So the exercises they so by exercising and correcting these postural in, the postural correcting the postural imbalance, this patient symptom indeed was able to eliminate some of the symptoms and signs of this diagnosis. So overall um, overall in the intervention was beneficial and have proven to enhance the quality of life for for a patient diagnosed with scoliosis, therefore revealing that the Strut method is useful in an orthopedic setting.
The diagnoses for Schroth method include idiopathic scoliosis, hyperkyphosis, and hyperlordosis. Originally, it was for adolescent scoliosis. However, patients of all ages can benefit, including those after surgery. The founder, Katharina Stroth, initiated the method by studying her own body, including her own spinal functions and the corrective movements. She also found that breathing played an important role in function as well. Originally, the patients with 80 degrees or above of the thoracic spine were the main focus. However, as progression improved, patients with less than 40 degrees and flat back were included.
Hello, my name is Andres, and I will be talking about what are the clinical outcomes when the Schroth method is tested against other interventions and modalities. I will mainly be focusing on Schroth method versus traditional non-surgical management versus surgery. So to start off, standard surgery, spinal fusion. The surgery usually requires an incision of about 45 centimeters on the patient. The surgery lasts about 4 to 6 hours, and the patient will be hospitalized for a period of about 6 to 7 days. Although this surgery is very successful in correcting the spinal curve, it leads to loss of range of motion of the spine. Since it entails fusing vertebrae together, this can lead to the possible disc degeneration in the future, causing lots of pain to the patient. Another type of surgery that I came across in my findings is ApiFix. It's less invasive surgery. It requires a small incision, and which is a size of 10 to 20 centimeters. The surgery lasts about 2 to 3 hours, and the patient is reportedly hospitalized for about 2 to 3 days. And the surgery is less invasive than the traditional scoliosis surgery, and a rod is implanted on the concave side of the curve. The rod elongates, leading to spinal distraction. The correction to the scoliosis starts during surgery and continues after surgery as the rod continues to expand, leading to more correction of the curve. Specific type of therapeutic exercises induce the elongation of the rod, which reduces the curve. Non-surgical management. First, I would like to talk about metacasting. It's a serial casting method applied to early onset scoliosis. The casting is usually customized and made of fiberglass. It's applied on the trunk in the operating room while the patient is under general anesthesia. It requires to be changed about every 8 weeks, and correction is usually achieved within 18 months. Next, yoga and Pilates. Yoga and Pilates serve as good ways to stretch and strengthen the back musculature. They improve posture and strengthening by strengthening the core and the muscles that support the spine. This can be done at home or rehab facilities and are fairly easy to learn and do. And they're usually entertaining interventions for the patients. Next, bracing. Bracing may help in stopping the curvature progression in children. It may help reducing the curvature in children and may help reduce the pain and discomfort in adults. This may be worn 15 to 24 hours a day, and in some cases, it should only be removed when during ADLs such as bathing. So now, Schroff versus others. So I found this article from South African Journal of Physiotherapy where the author, Marlette Berger, conducted a study. In her article, The Effectiveness of Schroff Exercises in Adolescents with Idiopathic Scoliosis, a Systemic Review and Meta-Analysis, she conducted a study to identify the best available evidence for the effectiveness of Schroff exercises in comparison to non-surgical management to reduce the progression of adolescent idiopathic scoliosis. Based on her findings, evidence suggested that Schroff exercises have significant effects in reducing the Cobb angle and improving quality of life in adolescents and idiopathic scoliosis. The Cobb angle is basically a measurement in degrees of curvature of your spine from side to side. A deviation of more than 10 degrees signifies scoliosis. The study. So also seven databases and 2 authors per article were assigned with task of cross-checking and making sure that the data used met the study criteria. Methodological quality of each included article was appraised using the PED-Pedro scale. The scale appraises internal validity and statistically reporting according to 10 criteria. It is deemed valid and reliable in assessing clinical trials. Study groups. So variation in dosages of Schroff exercises were present in the studies. The intervention groups received supervised Schroff exercise for 12 weeks, 3 times a week. For the home exercise group, Schroff exercises were taught to be performed at home for 6 months, 3 times a week. The control groups received non-surgical management like physiotherapy observation, bracing, Pilates exercises, and other at-home exercises 3 times a week for 12 weeks. In all of the articles, the studies measured, the data showed significant decrease in Cobb angle for the Schroff groups and slight increase in the Cobb angle of the non-surgical management groups. Based on the study, the Schroff method compared well against other non-surgical intervention as it not only prevented the increase of the Cobb angles of the participants, but it reduced it. In contrast, the other interventions proved only successful in minimizing the Cobb angle increase. When compared to surgical intervention, the Schroff method is simply a preferable method, mainly for the fact that it's minimally invasive.
Hello, my name is Daniel Arbari, and today I will be discussing the Schroff method. Now, in particular, the question that I'll be addressing is what are some negative aspects of the Schroff method? To start out, first I want to mention that the Schroth method has been shown to be very beneficial to scoliosis patients, even more beneficial than bracing alone. The Schroth method uses muscles as well as a breathing technique that in the long run realigns the spine. One of the negative aspects of this intervention is that it is very time consuming. Most people, when they go to a doctor or a therapist, they just expect a one and quick and easy solution to cure their ailment. However, this is not the case with this type of intervention. As Professor Ribeiro mentions in our interview, she sees her patients twice a week for a total of 12 weeks where they do intensive therapy sessions to realign the spine. This takes a lot of work and commitment and requires the patients to be attentive and focused throughout the therapy session because a lot of the instructional techniques given by the therapist can be complicated and difficult to understand. This can be seen as a negative aspect of the intervention because not a lot of individuals are willing to put the work that this intervention requires. Now, not only is a lot of concentration required by the patient, but also the therapist. The therapist has to pay attention how the application of intervention progresses in the patient. As the spine shifts with the Schroth method, everything shifts with it, and the therapist has to recalculate where everything goes. Therefore, the therapist has to make a judgment call to keep working on mobility or progress to strength training because strength training might infringe on mobility. This amount of attention and focus by the therapist cannot be achieved in every clinical setting, especially ones that are very busy. For this reason, this can be considered a negative aspect of the intervention. Now, in the article, stated as the efficacy of three-dimensional Schroth exercise in adolescents idiopathic scoliosis, a random controlled clinical trial. They state that adolescents do not like intensive exercise program and might have trouble focusing on exercise, as well as becoming distracted. So compliance is another issue with this intervention. Adolescents can see the most benefit out of the Schroth method because as the child grows, the muscles can be strengthened to correct the curvature of the spine. But the child has to be diligent to work at it. As mentioned in the interview with Professor Rivero, sometimes those children cannot comprehend certain techniques that the therapists want them to do and can stop coming or performing altogether the intervention and therefore regress back to their curvature. The professor actually makes a really nice analogy in our interview with her. She describes a tree that is swaying in one direction. So as you push the tree on the opposite direction, the tree will grow straight and tall. But as you stop applying that opposite pressure on that tree, it regresses back to its sway. This is what happens when one abandons the Schroth method. So a long commitment by the patient, there needs to be a long commitment by the patient with the application of the Schroth method. This is my works cited page. And thank you for listening.